Hey there everyone, welcome back to Studying with Stephanie. Today we're going to go more into our connective tissue properties and we're going to talk about cartilage as a type of connective tissue. Cartilage itself functions to help cover the ends of the bone and to protect from weight distribution and the forces that come with these type of things. We'll go more into the function in a little bit, but first we're going to talk about the 3 different types of cartilage. We have hyaline cartilage, which we as physical therapists are going to be working with the most. The hyaline cartilage is the cartilage that is within the synovial joints, such as the knee, the shoulder, and the hip. Then we have the elastic cartilage, which is more of the specialized cartilage within our ear and within our larynx or voice box. And then we have fibrocartilage, which we also work with as therapists because this involves our intervertebral disc, our pubic symphysis, and then our menisci as well. And the fibrocartilage is more functioning for a multi-directional shock absorption. So as we're leaning forward and diagonally, that intervertebral disc is able to take on those loads and all those forces from multiple different directions and take on that shock so that we don't damage the actual vertebrae itself. When we talk about hyaline cartilage, like I said, this is most of the cartilage in our body. This is the synovial joints. Within these hyaline cartilage, there is not blood flow, there is no lymphatic flow, and there are not any nerves. So when there is injury to the hyaline cartilage itself, we're not really going to feel pain, but there is also going to be a really poor turnover of the metabolism, which leads to really slow and poor healing of that tissue. But the healing doesn't come through the blood itself when it comes to hyaline cartilage. The nutrients that our cartilage get is through synovial fluid. And synovial fluid is within the joint already, and the way that this synovial fluid moves through the joint is through cyclic loading, where we're putting pressure onto the joint, taking pressure off, such as riding a bike or walking. That promotes the permeability because cartilage is very permeable already. That promotes the permeability, so these the synovial fluid can disperse through the cartilage and then back out into the joint through these pressure changes. All right, and so that cyclic loading is very important when it comes to healing because that allows the water to be pushed in and out of the matrix of the cartilage itself. And as we age, the actual water retention and the hydration of this matrix lessens. So as we age, the bone becomes more exposed to those pressures from the weight bearing and from the loads that we put on it, and this can lead to more cytokine activities, which is why as we age we get more of those osteoarthritic changes and that continued inflammation in our body because the water content within the matrix of the hyaline cartilage is not as strong as it was when we were a little younger. All right, and what cartilage also does, so it dissipates forces over a larger area so we don't get all of that damage to the bone itself. And then it also reduces the friction on the joint surfaces. It kind of creates this nice waxy buffer to allow for more smooth motion from bone to bone within the joint itself. When it comes to cartilage, the type of cell that the cartilage has and is developed from is a chondrocyte. And the chondrocytes themselves account for the cartilage development, the maintenance, and the repair of the cartilage. We're going to go more into depth because hyaline cartilage has 4 zones, and these zones essentially are the layers between the tissues. So we have the superficial zone. This is the hyaline cartilage that's on the outermost aspect of the bone. This accounts for 10 to 20% of the thickness of the cartilage itself, and it protects from shear, so that kind of crossing of fibers, one direction moving in this planar shearing force, okay? And this creates tension, so this initial superficial zone really is good at handling those shear and tensile loads that we put on the cartilage itself. And then we go a little bit deeper into the middle zone. Now the middle zone of the cartilage is actually 40 to 60% of the thickness of the cartilage. So this is the big mama, the middle zone. And that thickness helps to protect against compression, which again, we know our weight-bearing joints get a lot of compression throughout the day. So that middle zone, that 40 to 60% of the thickness of the cartilage handles a lot of that compression. And then we go into the deep and the radicular, so more of these round type of fibers of the cartilage itself. Now again, so we have superficial, middle, now we're going into the deep radicular area, and this is about 30% of the thickness of the cartilage itself. And this has a lot of proteoglycans, okay, so when we went back to the soft tissue, the proteoglycans are big protein macromolecules. And this also helps to protect from compression of the cartilage and the bone. And then we go into the tide mark, which is the deepest layer of the cartilage. The tide mark is the cartilage that is resting directly onto the bone, and this is calcified. So those calcium substances within the bone are blending into the cartilage here. And this blocks nutrients from leaving the bone itself. As we know, our bones have a lot of vascular tissue where our cartilage does not. So we want to make sure that we have that discrepancy between the bone and the cartilage, because the cartilage is there to protect the bone. So we don't want those nutrients getting out of the bone and going into the cartilage. So that's what this tide mark layer is for. So we go superficial, middle, deep and radicular, all the way down to the tide mark layer of the cartilage. Now, cartilage can get injured, and as I stated before, injury to the cartilage is not great because there's not blood flow, there's no nerve, and there's not lymphatic drainage in there. So when a cartilage gets injured and the cartilage itself is injured, we're not really going to know about it. If the cartilage injury does not penetrate into the bone below it, that is going to cause necrosis, which is going to lead to more of a breakdown of the tissue because, again, there's no blood flow to the area. So the synovial fluid really needs to come and take a part to help heal. And as I spoke about in the last video, the turnover time for collagen, so this collagen laid down through the synovial fluid, can take up to 300 days. So cartilage itself can heal, but it's going to take nearly a year for that cartilage to heal because it does not get the blood supply. So if we do not properly load these joints and properly exercise the cartilage injuries, then it can lead to even more breakdown and necrosis, which is when we get our osteoarthritis, because that cartilage gets broken down. It continues to get broken down because of the poor stressors that we put on it, and it never can get out of that inflammatory cycle and really heal, and then that breakdown happens and we are left with osteoarthritis. Now, cartilage injury is caused by a couple different things. It's caused by poor mobility within the joint. So it could be that the joint is hypomobile, so it's not moving very well. The synovial fluid is not getting flushed in and out of the cartilage to help with giving it the nutrients it needs. Or the joint can be too mobile, where now the joint is moving erratically and creating undue stresses on certain areas of the cartilage, which is leading to more of a breakdown of that part of the cartilage versus the other side. You'll see this a lot of people have medial compartment arthritis in the knee itself. That's more of that genu valgum, where that knee is getting pushed on the medial aspect, and as we move it gets broken down on one aspect, and the other side doesn't really get touched because it's a little bit further apart. Now that comes from, again, a little bit more of the hypermobility, that erratic instability within the joint. It's moving too much. And then also, if the joint isn't stable, we're going to get that breakdown because it's going to be pressing on certain areas of the joint and really cause more stressors and more of that weight distribution on one area. And then as well, another cause of injury is muscle performance. So if our muscles are not holding our joint in that proper alignment, in that proper position, and again, we're going more into this valgus because our glutes aren't really holding us up well or anything of that nature, we can lead to breakdown of the cartilage itself. Balance within the muscles, but also balance itself. If you're not able to hold the balance in the joint, again, the breakdown is going to happen because one area of the joint is going to get more stress and more pressure put on it than the other area of the joint. And then we also have activity limitations. So if we're not able to go and move, and we're not able to bend our knee to get up and down stairs or to walk, that synovial fluid is not going to be able to traverse and permeate the cartilage and give it the nutrients it needs so that cartilage can start to break down. So unfortunately, there is a lot of ways that our cartilage can break down. Any injury that we had in the past that can lead to instability or muscle imbalances or poor balance, poor muscular performance is the reason why people that are injured have more of a precursor to have arthritis in the future because that cartilage is now getting undue stresses onto it. All right. The cartilage also itself is by more so of the amount of load over time. So yes, it can get injured by a traumatic incident, but more so the cartilage is more susceptible to injury through continuous loads and the amount of load. So if you're a little heavier than what your body should be, that is more load on that cartilage. And over time, so now if I'm standing in one position for 8 hours and I'm not muscle balanced, and now I have 10-15 pounds of weight added onto my body, that amount of load pressing on that area over time is going to start to lead to that breakdown of the tissue. All right. And this also occurs because the extracellular matrix cannot lay down tissue as quickly as the tissue is being broken down. Those chondrocytes that are there to manage and maintain the cartilage are not able to lay down new tissue as fast as it's getting broken down. So unfortunately, cartilage is one of the top things that we see as therapists because there are so many different ways and so many different types of factors that come into play with the breakdown of the cartilage itself. And as I'm sure you've heard, motion is lotion, and this what it means is the more we move, the more we put proper stresses and proper exercise to these tissues, the better that the fluid is able to move through those tissues and we're able to lubricate those joints. So that's really important. And then there are also different types of cartilage injury. Not only can it be those forces within our body, it can also get injured due to developmental injuries such as just genu valgum as we are developing, or disease processes such as rheumatoid arthritis, and that's a continuous inflammation of the synovial joints, and that is that extracellular matrix not being able to put down new tissue as fast as your body is attacking and trying to get that tissue out of there. And then we have the degenerative changes, which is what we were talking about with the muscle imbalances and the poor loading of the joints. Also from joint instability and incongruity of the joint itself from those poor processes that have occurred over years and years and years. And then we also have immobilization, which can also damage the cartilage itself. Immobilization actually has an effect of damage to the cartilage similar to that of osteoarthritis. So that's why it is so important that we don't just immobilize someone for endless times and not get them moving that joint, because that joint needs the synovial fluid movement in order to get the nutrients and not have that breakdown of the tissue. So that is really, really important when it comes to being a therapist and trying to educate your patients on why it is important to move early on, and it could be passive movements, but the importance of proper loading to the joints, because when we know, back to the last video where we talked about the ground substance, and ground substance metabolic rate is 2 to 10 days. So 2 to 10 days of us not moving gets that hydration within that ground substance pretty much nullified, and that viscous tissue starts to contract up, and this starts to degenerate the joint. So it is so important for us to move and to not have someone immobilized longer than they need to be, okay? So always consult with the doctor who is prescribing the immobilization, and have that conversation of why they necessarily feel like the patient should be immobilized for certain amounts of time, and see what you can do as a therapist to help that patient get a little bit more mobility and a little bit more of that synovial fluid, so that the joint can get the nutrients it needs as it's trying to heal. All right, so that's it for cartilage. If you have any questions or comments, please drop them below. If you felt like this video helped you, please subscribe. As I said, we're going to talk about bone as well. We already have another video on connective tissue proper. So there are a lot of different types of injuries and tissues that we're going to talk about in this series. So please feel free to send this video to your friends. Let me know if you have any questions, or if you want one-on-one tutoring, I am here for you. Drop it down in the comments below. Thank you so much for subscribing, and have a great day. Bye-bye.